Welcome to Reconsider. I'm Bill Hartman. This is the podcast to challenge you to ask better questions, to look beyond traditional models of thinking and arrive at better health and fitness solutions.
So, Intensive 21 happened. Scottsdale, Arizona.
It did. Yes.
The
first intensive house.
Yeah, the intensive that didn't take place in Fishers, Indiana.
Yeah, that was weird.
Bill had an itch he could not scratch behind his eyes all weekend, trying to wonder why he felt a certain way, not being in his office in his house.
Yes, it was very weird. It was very weird.
Yeah. No.
It worked out great.
Yeah, it went really well.
Pleasantly surprised, actually. Yeah.
Really good group of folks.
I got to say something for one attendee. The pool was heated. The inside
just
joke
in case,
of the weekend. The pool.
There was a heated pool.
Yeah.
There was a heated hot tub, because I guess that's a thing at Airbnbs. You have to request the hot tub is heated.
Apparently,
it's not its default state.
Yeah.
Can we have the hot tub in hot mode, please?
Yeah.
So yeah, we've had a couple days to recover from that. I guess let's talk about what are some things you took away from that? Maybe talk about I think it would be good to get into maybe a couple of things that you saw as gaps of knowledge for people, things that maybe you had to explain that you weren't expecting to have to explain in as much of detail. Just stuff like that. Some talk about some reflections. There might not have been any. That's just things that come to my mind, is that there's always certain things. Well, I know based on my experience of, knowing you and talking with you for so long, there are oftentimes things that you think people should know or that are obvious to you that are not obvious to the group. So maybe if you can think of any examples of that, not to put you on the spot or anything.
Well, I strangely enough, I think some of the things are what I would consider very foundational. So it's actually just an awareness of just general anatomy. I think that's always a challenge for people. I think the big stuff is easy, and then the deeper you go, you start to recognize the fact that, I don't really know where such and such is, therefore I don't know what its influence is. And so I think there's a lot of that. So if we were to talk about a foot position and such, it's like just having a recognition of what is the structures that would be influenced. And you think about where muscles actually are and where they're attached kind of matters when you're trying to figure out movement, because I have certain influences that would be either in play or not based on where something attaches. So for instance, flexor hallucis longus is a muscle that's going to influence all the way into the toe, where, something else might be attached more proximally and not be an influence to that degree. And so we have to take those things into consideration. So I always think that that's the big challenge. What I would recommend for people in this circumstance is to not try to sit there and memorize anatomy. However, what I would do is the way you discover anatomy is ask a question, try to solve a problem, and then you start to recognize where the anatomy is, what it might actually be influencing. We talked about knee positions and elbow positions, and just recognizing, what actually crosses the knee joint? What actually crosses the elbow joint? Where are they attached? If they attach in a certain place, what type of an influence would they provide? And then we can start to see the turns that would be influenced, because a lot of the anatomy, the way it is taught, tends to be this sort of this rote kind of a thing. And then it's learned out of context. And so it's not very meaningful. And then when you do try to call it up in context, you're going, but that's the time to look. That's when you actually should look at the anatomy. It's define a problem, ask a question, and then try to solve the problem. And then the anatomy tends to get a little bit more sticky in that circumstance. So I think that's always a challenge for everybody. And I myself included. It's I am constantly going back and looking at anatomy. one of the great things about apps is because we can create these funky orientations that allow us to see things from different perspectives, but also recognizing the fact that we have to go into the mental model of the map is not the territory. It's like when I'm looking at an app, that isn't real anatomy. And so we want to look at combinations of things. And so the apps are very helpful to sort of initiate the search for how this anatomy may behave. But then we have to look at dissections. We have to look at isolated elements as we go deeper and deeper and deeper, so we can start to see the relationship. So we brought up something at the intensive when we look at literally the attachments on the calcaneus, and you look at the complexity of the attachments on the calcaneus, and what it allows is you to distinguish what is the greatest influence on the position of the calcaneus. It's like just doing that, right? Because everybody says, well, the Achilles comes down and attaches to the calcaneus, blah, blah, blah. It's like, and if you leave it at that, it's like you've left so much on the table.
Right.
Because we've got multiple attachments that are influential in controlling this position of the calcaneus into ER or IR. So stuff like that, I think that's always the big challenge for everybody to dig into. But like I said, if you do it in context, it's a lot more interesting. It's a lot more fun than just trying to sit there and go and look and stare at a muscle.
Do you find that? I mean, you're like dealing with this group of people, and you're talking about certain subject matters when it comes to like anatomy, physiology,
right.
origins, insertions, and actions. And like, are you like almost surprised that people don't have the level of knowledge about this stuff, or is it you think that people learned it in a certain way that wasn't really useful, was more on the rote memorization side, and they kind of just tossed it because it doesn't? There's really no use for a lever and pulley dead guy anatomy model in practice. Doesn't really help with anything.
Yes and no. I can tell you how I learned it, which was actually incredibly useful for just reproducing like where things are and what they do. So literally, I made flashcards, like my own. Like I bought a bunch of index cards, and muscle by muscle, I drew the anatomy on one side of the card. On the other side, it was like, and back in the olden days, we talked about origins and insertions, and those are just the proximal distal representations of dead guy anatomy, right? So you do
we still
insertion.
did that in the not so olden days.
Okay, origin, insertion, action, and then innervation.
Yeah.
So you get the nervous system involvement there, and so literally did that for every muscle. And so that was great because I had to go slow. It took time. Like it was effortful. One of the things that people aren't willing to do is to commit a degree of effort into things. So this was like as analog as it gets, right? So I was making my own app, if you will, right? But it was on note cards, which I'm used to doing because I'm an analog guy living in a digital world. Like I'm a pen and paper, I'm a note card guy all the time. The app stuff is very, very difficult for me to conceptualize. But again, this was like 100 million years ago when I was a young skull full of mush and didn't really know anything.
Did you say 100
million?
100
It's a long time. It's a long time. I'm really old.
Gotcha.
It was before you were born, Chris.
Okay.
So, and again, but it still has that element of rote. It's like learn, flip, learn, flip the card, learn, flip the card, that kind of a thing. And you can, and like I said, as useful as that is, it's still out of context.
Sure.
And then when it does come to context, now you have to go, what was that? And I saw this with my students too. Like I would challenge them a lot on anatomy, like where's such and such, where's such and such. And you kind of get a general idea. It's like, oh, Tom, Dick, and Harry, which is your deep posterior compartment to the calf, right? Tom, Dick, and Harry. They like you kind of know where they are, but do you know the orientation from medial to lateral as the representation goes? Do you know where they attach and therefore influence foot behaviors? And so little things like that get sort of lost in the lack of application in context. And so you always have, like, it is a continuous reinforcement that has to take place. Because I forget stuff all the time. It's like some of it's just age-related decline, and just some of it is just distraction, and I have other things that I have to think about. So I'm always coming back to it, always coming back to it, always coming back to it. And so it's one of those things that you have to keep up, or you will lose it.
Right. So do you think that, you and I talk a lot about how the intensive has evolved to such a degree that, I mean, even over this last week, or this last intensive, we had half of the group being returning. Some people had even been in the room 5 different times at this point.
Yeah.
But you have that person who's, been clinically practicing with this stuff under their belt for 6 years, probably at this point.
Yep.
Maybe not 6 years, maybe more like 4 years.
But yeah, we're getting close.
Yeah, 2017, right?
Yeah, 2017, 2018, yeah.
Okay, so yeah, it's possible that it has been 6 years for some of these folks.
One person was at the first one, so we just did 21.
We had
right? two people that have actually been in the first one, and so they've actually seen this whole process evolve into something that is like so big now that we're probably going to have to make some changes.
And we were talking a bit about like what becomes like you need to have everyone sort of brought up to speed in a way if you're going to have this higher level room. So having there be like a prerequisite course with the material that's more like closer to the rote side of things when you're talking about learning, a little more like, this packaged information through like infographics and slides and stuff like that.
Right.
But also what you're saying is that maybe there needs to be like some prerequisite work that people look into beforehand with some type of like complete, what's the anatomy app that you like to use? The complete anatomy.
There's a couple three. So like complete anatomy is really good. Essential essential anatomy and virtual body. Those would be like the big 3 that just pop into my head. There's probably others. And there's others that are segment like biomechanics of the spine is another one but it's just spinal in its representation. So there's a lot of really, I mean, it's amazing what they can actually do with these things now. But like I said, just to reiterate, it's really important that you understand that the exactness is not like if you have the opportunity to do a true dissection. It's like a typical cadaver, like a fixed cadaver dissection. Great. Even better, fresh cadaver dissections, hard to get, very expensive. But always seeking the next layer of depth in this regard, because some of these attachments that we talk about, even at the intensive, it's like they're really complex. Like we again, people make this assumption that this Achilles tendon is going to have like this one big attachment on the calcaneus, and it is much more complex than that.
Right. It's just a rope tied to a pulley.
Yeah, exactly. And obviously it's not. And then you say, well, if the calcaneus is this complex, then what is everything else? It's like, it's kind of like the same boat. You really need to look at this.
Well, let's, just as an example of what you're saying, let's talk about what the reality is at the Achilles there, and like how it is that like 4 parts that are kind of like a banana peel situation that are spiraled.
Right. So you have three major segments of this Achilles. And like I said, if you were to peel a banana into 3 segments, it's like, imagine that representation in a twisting format that then attaches to 3 different places on the Achilles. But we can also segment this out to like medial gastroc, lateral gastroc, and soleus, because they don't attach in the same place. And if we understand about like the complexity of this attachment, we can say, oh, the soleus is more of an influence in this representation. Lateral gastroc is going to be more represented in this orientation, and so on. And especially from a visual representation of a foot on the ground, we get a really strong representation of where somebody might be relative to early, middle, or late propulsion because of this, because we understand that as I move through space, I move forward through space in contact with a medium. That's propulsion. Okay. So that's how you define propulsion. I can start to see how one would be more influential in a representation. Therefore, I can identify the representation literally by the position of the rear foot.
Yeah, and it will help people, because a lot of people, I think, want to try to make this jump from anatomy as we traditionally understand it to like iterative anatomy. That is something that like
Right.
you talk about a lot in
Yeah.
your coursework,
Yeah.
which is not going to be found in a lot of other places. But a lot of that
Yeah.
just involves you having a really like really good working knowledge of all of these, like the true orientation of muscles and where they attach, and then being able
Right.
to look at how these sort of orientations and twists and turns happen in other parts of the body. So like the gastroc soleus 3 parts banana peel into the Achilles can be seen in other places, and specifically thinking like that, above that you see that in like the lats. Is that
Uh-huh.
yeah, so
Uh-huh.
you have like
Yeah.
the parts of the lat which actually end up sort of twisting and turning and being laid down on the rib cage and
Mm-hmm.
inserting into the pelvis, running all the way
Correct.
down to the calcaneus of the pelvis.
Right. Exactly. And we actually showed that representation last week. And it's quite clear when you like take all the other parts that sort of interfere with that view, you can actually see it very, very clearly that it is the same.
Yeah.
But again, if you didn't understand the foundational representation, you don't know what you're looking at.
Right. So that would be,
it certainly makes life easier.
And I'm sure you've talked about this before, but I think it would be good just kind of put this in this episode, would be like, what are the things? So the course before the course before the course, if we're talking about that, it's like the work that you need to do. There's certainly some of this stuff would be covered in your studies, undergraduate studies, graduate studies,
Yeah.
PT school,
Yeah.
Going to courses and stuff like that. But it's like understanding the basic laws of physics, probably Newtonian physics would be one thing to,
you don't have to get too
know.
wild and crazy. You don't have to get too wild and crazy. It's like Newton solves a lot of problems for you, right? Where you get into some of like the relativity is time involved, and then the
which is good to know.
Yeah,
basically, like time,
we talk
space,
about relative
space-time.
movement. We talk about relative movement because there is a relativity to it. It's like, but you don't have to like dig into Einstein's equations or anything like that to understand conceptually. There's like, oh, I have a representation where things seem to move together or things seem to move separately, and that is the distinguishing characteristic between relative motions and orientations. And but that's I would say it's a relatively simple concept to understand without the math, because I'm not a big fan of the math anyway. We don't have to do calculations. We just have to understand the meaning behind certain things. Like when we talk about momentum and we talk about torque and things like that, it's like, I don't need you to be able to calculate those things. What I need you to understand is that, oh, we have a force that's being applied, in rotation. That would be my torque representation.
Yeah, I mean, understanding what force is, understanding what power is, understanding the rate dependent aspects of physics.
Yeah, vectors are probably like the elephant in the room, right? If you don't understand what a vector is, you're going to be a little lost, because we have all these resultant behaviors that are associated with triangulation and rotations, right?
And I think it's a big, I think a tripping up point for a lot of people comes from not being able to progress their thinking to higher dimensions. So being stuck in a very 2D representation of like joint. A good example would be like throwing a goniometer on someone and taking a joint measurement, being a very 2D representation of something.
Very much so.
Might be useful, but very, very limited in what you can kind of glean from it. And then a three-dimensional model on a table where you're actually understanding the turns that take place in order to get into a joint position could be useful, but also sort of limited when you really need to look at things one step above in a four-dimensional model, which takes into account your position in time and space.
Right. Yeah. So you could have a segment. So you could have two segments. And in fact, this is actually like what happens. You would have two segments that are both moving in the same direction at different rates, and yet one segment would appear to move in the opposite direction. That's a huge point of confusion when we're talking about moving forward through space in contact with a medium, because there is a relative timing difference, but all things are moving in the same direction.
Yeah.
Right? And so then you get people that are doing Well, yeah, but you get people that are doing things that they say, well, the spine's turning this way, and then the pelvis is turning this way, and it's like, no, they're both turning the same direction, just at different rates. And so
Yeah.
again, that is your perception. But the problem that arises from this is that the attempts at solution are incorrect because the representation or the perception is incorrect.
Right. So it just, you lay someone on the table, measure external rotation of the shoulder, and think that everything is externally rotating with just this point of rotation at the glenohumeral joint, when that's not really what's happening. It's
Yeah,
like
just
each
because you
piece is
say it's
moving.
shoulder rotation doesn't mean that the movement that's a resultant of that is associated with that joint.
Right.
And that's a bitter pill to swallow because that's how it's taught. And then again, if that is my perception, is that I am measuring a shoulder when that happens, if I can't distinguish as to where that motion is occurring, and I resolve myself to the fact that, okay, this is shoulder range of motion and there's limitation. Again, my attempts at a solution often fail because that wasn't the problem to begin with. So again,
Right.
I'm trying to apply a solution that just doesn't fit the situation.
Yeah, and I think understanding too, we talk about like we've talked a lot about like what, when you're doing table testing, what the table and what people are doing as movement behaviors and reactions to the table kind of change the way that you measure. So it's like understanding that as well. It's like what given the time and the space that this person is actually in, or they're able to like sort of roll into or orient into, is causing your measures to be, dirty measures versus everyone measuring the same hip the same way, no matter where it is. That's just never how it's going to happen.
Correct. And so this is the statement that I always make, especially at the intensive, is like, you have to become reliable with yourself. You have to develop some measure of consistency in the way that you do things, and enough, because all measures are dirty. It's like I have pictures that are actually superimposed of a measurement, and you can see the movement of the entire system. If you're just rotating a shoulder, you can see the entire body moving through space as the shoulder is moving. And then to say that it's disconnected from the rest of the system would be grossly incorrect. It's like every time you're taking a measurement, you're taking a systemic measure. This is why we go through the assessment process like we do, because by looking at all of the other measures, you can actually determine where the motion is actually coming from, versus just making the assumption like, okay, I'm moving the shoulder, I'm measuring the shoulder.
Yeah. Okay. So basic physics. So we're still talking about like the stuff, the prerequisite information before the prerequisite course to the intensive model. But no, this is why, like, this is something that is going to the intensive. It requires you to be like someone who has a degree in, health, kinesiology, exercise physiology, physical therapy, chiropractic, like that sort of stuff. Like, and it also requires you to have this sort of working knowledge of these things to just be at like that foundational level. So the basic understanding of fundamental principles of physics, some type of like understanding of anatomy, like where things attach, like approximately how things are oriented in the body and what they do. And then I would say like you should have some working knowledge of physical therapy testing. So like table testing, even if you don't do it in your day to day, like you having some working knowledge of like what all of these measures are traditionally meant to show.
Traditional, and that's fine. It's like if you understand and we make reference to that. So we always distinguish between like a traditional representation versus something that's probably a little bit more closer to reality.
Sure.
Yeah.
But I'm just thinking about like if you were totally green to this thing and you walked into the first day of the intensive, what are the things that are just like expected that you would know? And I think I've named them all. I don't know if you can think of anything else.
You have to dip into a little bit of the physiology associated with energy production. That's going to be helpful. A little bit of it, like the mechanical element of breathing, because again, that's going to be mentioned, because it is an influence, right? And so and again,
perhaps
some of that
some
falls
type
towards
of like exercise physiology book.
Yeah. And you know, we talk about that on the application. It's like, hey, you should probably have this level of understanding of physiology and anatomy before you try to walk in the door, because again, you're going to be lost otherwise.
Right.
Yeah.
So though, So this is more
not,
for like
this has never been the first course that somebody would ever want to take.
Right. So that's kind of what I'm trying to direct this conversation towards, is like, what would be like the first courses to take, or like what would be the things that a practitioner that wants to learn this model would almost have to like go back to refresh.
Yeah.
And that would be like, you know, that would be the basic physics, that would be the anatomy stuff, and that would be some form of like understanding exercise physiology, and then assessment in more of the traditional.
And you just need exposures. You need exposures to it. So like if we said shoulder external rotation, you knew what we would mean when we talk about shoulder external rotation.
Yeah. So even if you don't do it, having done a few of them is helpful.
Well, if you're a strength and conditioning coach and you don't do table tests and you go, I don't need to understand the table tests, you should understand the table tests actually. So how are you going to communicate if you're on a staff, especially if you're on a staff and there's multiple departments within that staff that's dealing with performance? It's like, and somebody walks in the door and says, hey, is ER, IR this and this and this? It's like, you should have a general understanding of what that means. Yes. Otherwise you're sort of flying blind, and now you have a barrier in communication that eventually becomes a little bit of a sticking point, because the athlete's going to be the guy stuck in the middle of it between the rehab and performance sides.
Yep. Okay. I think we covered basically everything I wanted to cover. Do we want to tell people to be on the lookout for some opportunities coming in this year for like the prerequisite stuff?
You're putting a time constraint on me.
Well, we're gonna do it this year, Bill.
It's gonna be this year.
It has to be this.
It has to be this year. It has to be this year.
We're bringing it to you. I'm not making you go anywhere for this. You just gotta park. You gotta get to the Omni Hotel. That's what you gotta do.
Everybody's coming to my house.
40 people sitting in the house.
Hey, we've done that. We've had 40
you
people
could
here.
If iFast is actually fixed, you could do it at iFast.
If it's fixed. That's funny.
You'll have room, right?
I think so. Yeah.
I guess you have to whatever Saturday and Sunday schedule is for the basketball.
Yeah, we'll probably have to. We'll scale it. We'll scale it up for those fine people.
All right, goodbye everybody. If I haven't cut this video yet. So yeah, let me stop this, and then